Imagine someone hands you a piece of paper, right? And if you sign it, you legally agree to let a scientist inject you with some experimental, totally untested chemical.
Yeah, I mean, most people would probably run the other way.
Exactly. But what if right before you walk out the door, the scientist says, hey, if you sign it, I'll buy your family a brand new refrigerator?
Oh, wow. Yeah, that changes things.
Suddenly you
Yeah.
pause, right? And that brings up a really tough question. Where is the exact line between science, normal compensation, and just flat out bribery?
It's a remarkably thin line, honestly. And without a massive, globally recognized ethical framework, human judgment easily gets clouded by, incentives or ambition or even just plain ignorance.
Which is exactly why we are here today. Welcome to the deep dive. Our mission today is highly specific, and it's directed entirely at you, sitting right there, getting ready to absolutely crush your exam.
That's right.
We are breaking down Lecture 19, the Ethical Framework for Health Research, straight from your basic course in Biomedical Research notes.
And look, ethics can sometimes feel like just dry paperwork to memorize. But if we actually look at what these rules are doing, they form the foundational backbone of trust in science. I mean, they exist to protect human lives.
Absolutely. And to make sure you're protected on test day, we are going to walk through all 30 of the multiple choice questions from this lecture. But we aren't just going to read an answer key.
Right, that would be boring.
We're grouping them by core concepts. So, historical milestones, the 4 pillars of ethics, the realities of informed consent, institutional review, and vulnerable populations.
Let's start with the history, because before you can really memorize the rules, you kind of have to understand why they were written in the first place.
Right. It's kind of like building codes, you know?
Yeah.
You don't usually get a strict rule about fire escapes until, unfortunately, a building burns down. The same goes for human research, right?
Unfortunately, yes. For a long time, the burden of ethics was entirely on the individual doctor. We didn't really have universal rules until historical tragedies forced the international community to, draw a line in the sand.
Isn't it wild that we didn't always have these universal rules protecting patients? I mean, it seems so obvious now.
It does, but it took a lot of hard lessons to get here.
Well, let's see how the exam tests that history. I'll read the exact question number, the prompt, and your options. You listen closely and lock in your guess, and then we'll break down the logic. So, question 1. Which of the following guidelines, discussion on rationale and justification of risk-benefit analysis of research and voluntary consent in research was initiated? A. Belmont Report. B. Helsinki Declaration. C. Nuremberg Code. D. CIOM's Guidelines.
So the foundational answer here is the Nuremberg Code. Basically following the horrific medical atrocities of World War II, the Nuremberg Code was drafted in 1947.
Wow, okay.
Yeah, it was the very first time an international document declared that voluntary consent from human subjects is absolutely non-negotiable.
So Nuremberg was really the global starting point. That leads perfectly into question 16. Which of the following have the guidance in the Belmont Report? A. The procedure of informed consent. B. The basic ethics principles of autonomy, justice, and beneficence. C. Review by ethics committee. D. All of the above. E. None of the above.
For this one, you can confidently circle all of the above.
Okay, all of them.
Right. While Nuremberg started the conversation in the 1940s, the Belmont Report was created in the United States in the late 1970s. It kind of took those early ideas and formalized them into the comprehensive modern system we use today, outlining the core principles, detailing informed consent, and requiring ethics committees.
Makes sense. Now, exams love to throw in a distractor option that sounds official but belongs to a totally different topic. Look at question 23. Which of the following does not describe ethical principles in research? A. Nuremberg Code. B. Helsinki Declaration. C. Council for International Organization and Medical Sciences. D. Fore Report.
Any guesses on this one?
I'm guessing the odd one out is D, since we just talked about the others being global ethics frameworks.
Spot on. The correct choice is the Bohr Report.
Nailed it.
Yeah, Nuremberg, Helsinki, and CIOMs are all global ethical guidelines. But the Bohr Report, which was issued in 1946, was fundamentally about developing healthcare infrastructure and policy in India. It's a structural document, not a global ethics code.
Okay, so we've established that historical disasters forced us to rate the rules.
Yeah.
But what actually are the rules?
That brings us to our second segment, the 4 pillars of ethics. These literally govern every single clinical trial today.
And those are autonomy, beneficence, non-maleficence, and justice.
Exactly.
But I have to push back a little here. Beneficence means doing good, right?
Right.
And non-maleficence means doing no harm. In a hospital, aren't those the exact same thing in practice?
It's a really subtle but crucial distinction for the exam. Beneficence is a proactive, meaning you are taking active steps to improve health and maximize benefits. Non-maleficence is protective. It means ensuring that whatever you do, you aren't inflicting deliberate harm or, unnecessary risks. Think of it as beneficence is giving the cure, and non-maleficence is making sure the cure isn't worse than the disease.
Oh, that makes so much sense. And that distinction is going to be the key to this next batch of questions. Let's look at the first pillar. Question 5. In the middle of a clinical trial, one participant decides to withdraw from the trial, but the investigator pressurizes the participant to continue in the study till it completes. Which of the following ethical principles does the investigator violate? A, justice, B, autonomy, C, beneficence, D, non-maleficence.
The violated principle here is autonomy.
Autonomy.
Right. Literally means self-governance. The participant has the absolute right to control their own body. If they want to walk away on day 2 or day 200, they can without any pressure at all.
And the exam hits this concept from multiple angles. Let's look at question 12. A study participant can be forced by the investigator to continue in a trial against his will. This is in conflict with which of the following ethical principles? A, autonomy, B, justice, C, beneficence, D, none of the above.
Same logic as before. The answer is autonomy. The absolute key word here is forced.
Oh, force.
Yes. The moment a researcher applies force, they totally strip the patient of their self-determination.
And question 22 basically drives the nail in the coffin on this concept. A participant wants to withdraw from a study before its completion. Which of the following principles of ethics entitles him to do so? A, autonomy, B, justice, C, beneficence, D, non-maleficence.
You can lock in autonomy for that one, too. Notice a pattern here. For your exam, anytime a question mentions a participant's right to choose, to join, to leave, or to refuse, the answer is always, always going to be autonomy.
All right, let's pivot from the patient's choices to the researcher's responsibilities to protect them. Question 7. Do no harm concept was emphasized in which of the following ethical principles? A, justice, B, autonomy, C, beneficence, D, non-maleficence.
The answer is non-maleficence. If you ever get stuck on this, just break down the root word.
I like the prefix.
Exactly. Mal means bad or harmful in Latin, like malfunction or malicious. So non-maleficence literally translates to no harm.
Let's see if I can use that logic on a trickier phrasing. Question 13. The physician should do what is medically indicated, do good than possible harm. This principle is encompassed in the ethical dimension of A, beneficence, B, justice, C, non-maleficence, D, economy.
Take your time with this one.
Now, the prompt says do good, which makes me want to instantly jump to beneficence, but it also emphasizes avoiding possible harm.
You're right to hesitate because examiners love this trap. But strictly according to your course key, the answer here is non-maleficence.
Wait, really? Even with do good in the prompt?
Yes. Even though the phrase do good appears, the core directive of ensuring a medical treatment avoids causing disproportionate harm falls safely under the umbrella of non-maleficence. It's about protecting the patient first.
Good to know. Mark that one down, folks. Question 25 is much more straightforward. Non-maleficence means A, self-respect, B, do no harm, C, fair and correct, D, doing good.
You don't even need to blink at this one. The answer is do no harm.
Perfect. So we've covered autonomy, beneficence, and non-maleficence. Let's look at the final pillar. Question 10. In a clinical research, the researcher knowingly excludes recruitment of female participants without any compelling indications. Which of the following ethical principle does the investigator violate? A, justice, B, autonomy, C, beneficence, D, non-maleficence.
This researcher is blatantly violating justice.
Because it's not fair.
Exactly. In the world of medical ethics, justice doesn't mean putting criminals in jail. It means fairness. It dictates a fair distribution of the burdens and the benefits of research. You can't arbitrarily exclude a demographic because then they miss out on the medical advancements.
And question 30 proves this is a major theme. When a particular ethnic group is excluded from a research study without any valid scientific reasons, this is breach of A, autonomy, B, justice, C, beneficence, D, non-maleficence.
Exactly like the gender exclusion scenario, the answer is justice. Equality, fairness, and unbiased selection, those are your buzzwords for justice.
All right, this brings us to segment 3, the mechanics of informed consent. Because, autonomy and justice sound beautiful in a textbook.
They do.
But in the real world, how do we actually prove a patient understands what they're getting into? I mean, people just skim terms and conditions and hit agree on their phones all the time. So what does this all mean for the paperwork? Is informed consent just getting a signature on a dotted line?
If a researcher treats it like a simple signature, they are completely failing ethically. Informed consent is not an inescapable contract.
What is it then?
It is a continuous, educational dialogue between the researcher and the human being who is offering their body for science.
Let's test that reality against the exam. Question 4. Which of the following is not important in the context of an informed consent document? A. Detailed description of study procedures. B. Budget of the study. C. Details regarding compensation and post-trial access to care. D. Contact details of the principal investigator.
What do you think?
If I put myself in the patient's shoes, I really care about option C, my compensation. And I definitely don't care about option B, the lab's overall spreadsheets. Am I on the right track?
You nailed it. The answer is the budget of the study.
Awesome.
The participant needs to know what will happen to their body, who to call in an emergency, and how they personally will be compensated. But the overarching financial budget the university received is totally irrelevant to the patient's medical autonomy.
Question 15 sort of flips the script. Which of the following is not true about an informed consent? A. IC helps participants take an informed decision about participation in the research study. B. IC has information on potential risks and benefits of the study. C. IC process intends to protect the study participants. D. IC taken by coercion is considered valid.
The completely false statement here is IC taken by coercion is considered valid.
Because coercion is basically forcing them.
Right. Coercion means using force or threats. The second you threaten someone, autonomy vanishes and the consent is completely voided.
Got it. Now, question 18 explores that ongoing dialogue you mentioned earlier. The process of informed consent can be repeated several times during the research study, if necessary. A, true. B, false.
That is absolutely true.
Even after they sign.
Yes, remember, research evolves. If the study protocol changes or researchers discover a new side effect halfway through, you absolutely must go back and reconsent the participants with the new information.
Okay, question 26. State whether true or false. Once a participant has provided informed consent, it cannot be withdrawn. A, true. B, false.
As we hammered home during the autonomy segment, that is false. A participant can withdraw consent at any moment for literally any reason without penalty.
Here is question 27. And pay attention to these three options carefully. Which of these is not a part of informed consent process? A, confidentiality. B, disclosure of risks and benefits. D, encouraging the person to consent.
The correct answer is encouraging the person to consent, and this trips up a lot of students.
I can see why. It sounds friendly, right? Like you're just encouraging them.
Right, but as a researcher, your job is to inform objectively. You are not a salesperson trying to hit a recruitment quota. Encouraging or pushing them really crosses the line from education into undue pressure.
That makes total sense. Now, what happens when the patient isn't legally old enough to understand all this?
Special rules apply there.
Let's see. Question 20. In an observational study on menstrual hygiene among school-going girls aged 14 to 16 years, informed assent will be required to be taken from the adolescent girls. In addition, informed consent will be required from A, parent of adolescent girls, B, institutional head, C, both, D, none of the above.
For this, you must get the parent of adolescent girls. Let's break down the jargon here because the exam will definitely test you on it.
Yeah, what's the difference between assent and consent?
Minors lack the legal capacity to give consent. Instead, they give assent, which basically means the child agrees to participate. But legally, you still require formal consent from their parent or guardian.
Oh, that completely solves question 24. When a research study is planned among adolescents, 12-15 years, the following is not required. A, assent from participant. B, consent from participant. C, consent from parent. D, consent from legally accepted representative.
Exactly. The thing that is not required is consent from participant. Legally, an adolescent just cannot give it. They can only provide assent.
Okay, moving into segment 4, the gatekeepers. We have all these noble principles and we have the consent paperwork, but scientists are human. They get eager, they want to publish. Who actually polices them?
This introduces the Institutional Ethics Committee, or the IEC. Think of them like a building inspector.
Okay, how so?
Well, they don't care if a restaurant serves good food. They only care if the roof is going to cave in on the customers. They look out for safety.
But here's where my brain gets stuck. Does literally every single thing a scientist looks at require an ethics committee to sign off? I mean, what if I'm just looking at old files?
That's the nuance you need to know. The committee wants to facilitate safe research, not block it with red tape. There are very specific caveats regarding what requires going back to get fresh patient consent versus what just requires a standard ethics committee review to ensure data safety.
Let's see how the exam handles that nuance. Question 2. In which type of the following study or studies is informed consent not necessary? A. Investigation of an outbreak. B. Analysis of mortality data of 2001-2010. C. Using verbal autopsy to determine the cause of death. D. All of the above.
The answer is analysis of mortality data of 2001-2010,
Why that one specifically?
because it is retrospective anonymous data. The patients are already deceased, and the data is archived. You physically can't get new informed consent to analyze past statistical records, and ethically, you just don't need to.
But wait, look at question 3. In which of the following type of research ethical review is mandatory? A. Prevalence of HIV infection using blood investigation. B. Awareness about diabetes using questionnaire only. C. Calculate out-of-pocket expenditure using secondary data. D. All of the above.
Take a close look at the options.
Well, if option C is secondary data, why would that need review if we just said old data doesn't need consent?
You're confusing consent with review. The answer is all of the above.
Ah, I see.
You might not need to hunt down patients to reconsent them for secondary data, but you always need the ethics committee to review your plan. The committee needs to verify that you're actually handling that data safely and anonymously.
That makes perfect sense. Let's look at question 11, which gets even more specific. In which of the following situations is ethics review essential? A. When already available or archived data are used for research. B. Involving some risk when some questions are asked, some samples are collected, or some drugs are given. D. Only B.
Based strictly on the provided course key for this specific question, the answer is only B.
Interesting.
Yeah, while general secondary data often gets a fast-tracked exemption review, this question emphasizes that a full essential ethics review is definitively triggered by active risk, like collecting new samples, asking probing questions, or giving drugs.
Got it. Question 21 drives the baseline rule home. State whether true or false. Review of health records for research does not require approval of Institute Ethics Committee. A. True. B. False.
That is false.
Because they still need to check it.
Exactly. The IEC is the ultimate guardian of data privacy. Even if you don't need the individual patient's signature, you absolutely still need committee approval to access those health records.
And they enforce this rigorously, right? Look at question 14. Study monitors, regulators, and ethics committee members have an authority to verify the consent documentation of research participants. A. True. B. False.
Absolutely true. They aren't just a rubber stamp at the beginning. They have full authority to audit the paperwork any time to ensure the researchers are playing by the rules.
But there are limits to their power. Look at question 17. Which of the following is typically not within the domain of ethical review of the proposed research? A. Novelty of research. B. Competence of researchers. C. Relevance of research. D. To advocate for the study in the community.
The answer is to advocate for the study in the community.
Because they're independent.
Right. Going back to your building inspector analogy, the IEC is an independent objective safety board. They are not a marketing or PR firm hired to hype up the researcher's work.
Question 29 tests another thing the IEC does not do. Which of the following is not a responsibility of the Institutional Ethics Committee? A. Evaluate the potential benefit from the study to the community. B. Protect the rights of the study participants. C. Sanction funding for the study. D. Reevaluate the study if and when modified.
You can just cross out the money. The answer is sanction funding for the study.
So they don't touch the budgets.
Never. The Ethics Committee deals strictly with morals, safety, and rights. The actual bank account and grant money are handled by entirely different financial committees.
Which perfectly transitions us to our fifth and final segment, money, incentives, and special populations. If the IEC doesn't hold the purse strings, how do money and ethics intersect? Because paying people to be a lab rat feels like a massive ethical gray area.
It is a huge gray area.
If I'm taking time off work to be in a study, shouldn't I be paid? Where is the line between compensation and bribery?
It's all about ensuring the money doesn't blind the patient to the risks. You should be compensated for your travel expenses and lost wages so that participating doesn't put you in debt.
That makes sense.
But the moment the money becomes a massive, life-changing reward, it completely clouds human judgment. People will happily ignore severe health risks just to get a giant paycheck.
Let's see how the exam tests this exact tension. Question 6. Which of the following are not ethical practices in health research? A. Taking informed consent from participants prior to study participation. B. Giving a lot of money to increase study participation. C. Lack of adherence to study protocol. D. B and C.
The clearly unethical practices are B and C. You obviously cannot go rogue and ignore the study protocol, and you cannot throw lots of money at people just to boost your recruitment numbers.
Question 19 gives us that incredible real-world scenario we talked about at the very beginning. As part of evaluation of a new vaccine, which requires taking a daily oral dose of a refrigerated vaccine, the research team offers to provide a refrigerator to families of participants who don't have one. Which of the following ethical issues the Institutional Ethics Committee will have to deal with while reviewing the research study? A. Undue inducement. B. Coercion. C. Compromising principle of justice. D. None of the above.
The ethical violation here is undue inducement.
Undue inducement.
Yeah. A whole new refrigerator is a massive financial incentive, especially for a struggling family. It's so overwhelmingly attractive that a family might completely ignore the unknown risks of an experimental vaccine just to get the appliance. It induces them to take a risk they otherwise wouldn't.
Let's solidify the rule with question 28. Which of the following statement is not correct?
A.
Compensation for participants is offered for trial-related injury. B. Research participants can be paid for travel expenses. C. Payment can be offered to encourage participation. D. Wage loss of the participants can be compensated.
The statement that crosses the ethical line is, payment can be offered to encourage participation. Just remember the golden rule: you compensate to make them whole for losses like travel or wages, but you never pay them a reward simply to encourage joining.
Got it. Let's bring it home with two final questions on special populations. Question 8. Genetic research that involves human participants and conducted by a private research institute should follow A. ICMR guidelines, B. Genome Policy and Genetic Research 2000, C. Both A and B, D. Neither A nor B.
The correct answer is both A and B.
Because it's genetics.
Exactly. Genetic data is the most sensitive information a human being has. Therefore, any institute must comply with both the general medical research guidelines and the hyper-specific genome policies.
And our final hurdle, question 9. While conducting research among tribal populations, which of the following is recommended? A. Consent from the tribal head. Group consent is desirable. B. Group consent can replace individual consent. C. Women can be excluded from informed consent process. D. Confidentiality not required.
The recommended approach is consent from the tribal head. Group consent is desirable.
Just desirable.
Yes, when working with specific, tight-knit communities, respecting their social structure and leadership is crucial for building trust. But please remember, for the exam, this group consent is desirable alongside individual consent. It never magically replaces the individual autonomy of the actual participants.
Wow. We did it. Take a breath. That is all 30 exam questions locked in. We've journeyed from the historical tragedies that birthed the Nuremberg Code, stood up the 4 pillars of ethics, mastered the continuous educational nature of informed consent, learned exactly what the Ethics Committee inspects, and navigated the really tricky waters of undue inducement and vulnerable populations.
You have a conceptual framework now. You aren't just memorizing, you actually understand the why. Just remember to read the questions carefully on exam day. Look out for the difference between assent and consent, and hunt for those keywords like autonomy, justice, and undue inducement.
But before we let you get back to studying, let's connect all of this to the future. If these rules, Nuremberg, Belmont, the 4 pillars, were painstakingly built for humans testing physical drugs on other humans, what happens right now, as we speak, when we introduce artificial intelligence into health research?
Oh, that is the most urgent ethical question of our decade.
Right. If an AI algorithm analyzes your data and makes a biased health prediction, who is ethically responsible? The coder? The doctor?
Yeah,
AI?
exactly. How do we ensure that the principles of autonomy and justice actually survive when a black box machine is making medical calls?
It's a massive gray area, and maybe one day they'll be writing new exam questions about it, something to mull over as you review your notes. Good luck on the exam. You're going to crush it. Thanks for joining us, and we'll catch you on the next deep dive.